How about hormones? DHT is significantly increased. So DHT is so your body converts testosterone to DHT, and DHT seems to be a contributor to BPH, but so is estrogen, as we spoke about earlier. All right, and this relationship with estrogen, testosterone, the ratios. So when I'm going to give a talk, today is a talk day. I'm going to give several talks. In a few hours, I have another talk with a group of doctors. We're going to talk about hormones and men's health. And the big takeaway there is that it's not only the absolute number of testosterone or estrogen, is the ratio between one and the other that matters, right? The ratio between two hormones, estrogen, testosterone and DHT, testosterone and free testosterone. Those are the things that matter. Anyway, so here is the same scenario. The bottom line here is that estrogen is contributory to BPH, and that needs to be addressed and looked at. So what are some of the herbs that are and botanicals that are used for BPH? So saw palmetto is actually, so it's interesting because I took, as a naturopathic doctor, I did extensive research on botanicals in general. And I'm also part of the American Herbalist Guild, et cetera. Saw palmetto is an excellent botanical for men and women. So some time ago, saw palmetto was connected just for prostate. And so when you hear saw palmetto, you think prostate health, but it's good for urinary dysfunction in both men and women. So it's been used for decades, if not centuries. And it has no effect on PSA values, meaning that it doesn't falsely lower PSA. Why am I saying that? I'm saying that because the pharmaceutical drugs, 5-alpha reductase inhibitors, so this is your finasteride and your dutasteride, Proscar is a trade name, and Avidart, they are 5-alpha reductase inhibitors, but it also falsely lowers your PSA. What that means is that if your PSA, let's say you go to the doctor, you're a 62-year-old man and you are on finasteride, and your PSA is 4.5, that really means your PSA is like a 9, because if you're on finasteride or any of these drugs, because these drugs falsely lowers PSA. Saw palmetto does not do that. Okay. Numerous studies looking at saw palmetto and its efficacy. The bottom line is this: and for mild to severe symptoms, it might not be as effective. For moderate to severe symptoms, it might not be effective. In cases where it's just mild urinary problems from the prostate, it might be effective. In my practice, I don't use saw palmetto a whole lot, honestly. I think other things are better that we're going to talk about. I do think that it might be helpful, but only as a standalone, in just not in a formula. Probably at dosages about 720 milligrams or so a day. But I do think that a good formula works better than just saw palmetto alone. But saw palmetto in a formula I would not use. I will use it as a standalone, and then maybe other things. But again, in my practice at this moment in time, it's not my main go-to. Curcumin is one of my main go-tos. Curcumin is from the turmeric spice, and it's just a very powerful anti-inflammatory. And anytime you have a good anti-inflammatory molecule in your system, good things happen. And curcumin seems to work very nicely for BPH and all prostate problems, actually. So the big three are BPH, prostatitis, and prostate cancer. And it seems, and curcumin seems to help with all three of those prostate issues. So you get a lot of bang for your buck with curcumin. Curcumin is one of my main go-tos, and I give curcumin to most of my patients, unless they have get some GI distress from curcumin, which most people don't, but some do. Pygeum. So many of the formulas have Pygeum Africanum in it, but I don't use it because, according to my friend Dr. Eric Yarnell, who's a herbalist and a men's health expert as well, he says that this is an endangered species. So I just don't use it. And honestly, we don't need to. There's other great things to use. Curcumin is one of them, and we'll talk about others. Beta-sitosterol. So many studies have shown that this is beneficial. Beta-sitosterol is a chemical found in saw palmetto and many other botanicals and natural agents. It's been used, and sometimes you do see this in formulas. It hasn't been studied for a while, but many of the older studies that looked at it shows that it may be beneficial in helping with urinary problems. All right. What's the diet and lifestyle for BPH? Flax seeds, at least in rats, seems to help. Not the oil. I would stay away from the oil. And I know that there is an old treatment for prostate cancer called the Budwig diet. And pretty much that was a flaxseed oil and cottage cheese diet for prostate cancer. I think that Budwig and its practitioners back in the day, this is what they had, but I think that information is outdated and it's no longer what I would, or anyone would suggest that I know for prostate cancer. But the flax seeds, the seeds themselves are beneficial. And so I would recommend that. Physical exercise. There's a strong association with physical exercise and BPH and lower urinary symptoms. And selenium. The type of selenium that I use is from selenized yeast. I don't use things like selenium methionine. I think that too much selenium methionine can increase possibly the possibility of prostate cancer, but I use the selenized yeast, which has selenium methionine, but other forms that seems to be protective. And that's from research that in the selenium and vitamin E trial. I may talk about that in a little bit, but I don't want to get bogged down with the too much scientific jargon. But selenium is from selenized yeast is the better approach.